Informed approach. I'm just looking at my time because I don't want to be the one that gets us up behind schedule. Okay, so for the trauma-informed portion of things, I know that many of you already practice with a trauma-informed approach. So this is not a big trauma-informed talk. As a matter of fact, we just did a grand rounds on just this a couple of weeks ago at the Department of Family Medicine. So these are just highlights. And honestly, many of you are practicing this already, but it's just labeling it as that. And so recognizing that when you are doing this, this is a trauma-informed way. So what is trauma? Trauma can be broadly defined as experiences that overwhelm an individual's capacity to cope. And it can have lasting adverse effects on a person or community's mental, physical, social, emotional, or spiritual well-being. And trauma can be in many different forms. It could be a single event. It could be repetitive. It can be very complex. It can occur as a child, so in a developmental time of their lives. It can be intergenerational or historical, which we see in our Indigenous peoples, for example. And it's more prevalent in our vulnerable populations, whether they're a transgendered person, or Indigenous or a particular culture. Refugee populations, for example, are more at risk for trauma. I mean, think of the refugee who's coming from the Gaza Strip, for example, right? That's real trauma and very, very common. Okay, so how common? 76% of Canadians have experienced some form of trauma in their lifetime. Okay, and it's so pretty well everyone in here may have experienced some sort of trauma, and you never know, and many people will not tell you. So it could be your colleagues, it could be your patients, it could be your friends. And I was talking to Dr. Winnick because we were preparing for our session today, and we were having some discussions, and I recognized that some of my choices and how I was counseling patients is based on my traumas. And I was like, ding, 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 ding. It was pretty, so as a kid, for example, I had a dental procedure when I was 5. And it was very traumatic for me. They sent my mom out of the room. They did their thing. They extracted a bunch of teeth, but I was 5. And then when I was done, he sent me out of the room. He says, go find your mom. And I got lost in the hallway. And well, that was it. I was 5 and I was like, somebody's just done some horrible things to my mouth. And I started crying. So after that, anytime I went to the dentist or had a needle, no one could touch me. And so it's amazing I'm even a doctor, because the idea of going to see a doctor, getting my teeth done, that was like, forget it. So I realized the other day, so I asked Avery, Dr. Winning, because I was saying, I tend not to offer IUDs in a NULIP in a teen girl, because I think it would hurt. And she says, actually, you know what? If you are very trauma informed and you take your care with your patients and you give them some naproxen, actually, they do pretty good. I was like, okay. So I realized actually that my childhood experience was actually informing or changing the way I care for my patients. So anyways, it was a bit of an eye-opener for me. So how do we recognize trauma? We recognize trauma because it can come up in different ways. It could be as anxiety, like I was anxious. It could be in the form of frequent questioning or indecisiveness or avoidance. So that patient who keeps missing their appointments and doesn't want to show up, maybe it's not because they're being rude. Maybe it's because they're avoiding healthcare in general because it's very traumatic for them. They may have a lack of trust or seem hostile to you. They may have boundary issues where they're in your office all the time. They're asking you all kinds of questions that have nothing to do with medicine, it may seem like. So, trauma-informed care and clinical care, it is important for us to develop communication strategies that promote safety, trust, empowerment while avoiding re-traumatization. So why am I bringing this up today? Because we are all going to be rubbing shoulders with our learners and teaching them how to take a history, how to examine a patient. And it's important to recognize that you are doing these things in a trauma-informed way. And just to kind of signpost it, just like when I talked to you about feedback this afternoon, sometimes you have to signpost that you're giving them feedback because sometimes learners just think, oh, it's just a conversation. We were just talking. And yet you were teaching and you were teaching hard the whole time and they did not recognize it. Okay, so some of the things for trauma-informed approaches in communication is word choice and framing. So using neutral terms that don't have dual meaning. So for example, saying examination table instead of bed and drape instead of sheet. Use easily understood, neutral, and non-intimidating language. Focus on what happened to the person rather than what's wrong with the person. So I use that example, for example, the patient who's always late or the patient who's missing appointments. Maybe there's something going on in their life that's resulting in them being late. Avoid judgmental terms like violence, abuse, or criminal behavior if the patient doesn't initially recognize the experience as such, and use the words healthy instead of normal when discussing body parts. Permission and consent is an important part of trauma-informed care. So again, we do this all the time. We don't think about it, but asking permission before touching. May I examine your abdomen now? Is it okay if we proceed with the pap smear and this is how it's going to look like? Explain the presence for additional staff. So if you're doing a pap smear, you say, is it okay if we have the nurse for support, or is that okay with you? Warn about sensations. You may feel some pressure now, or this might feel cold. Giving patients empowerment and choice. I mean, we all remember the times where doctors just told patients, this is what you do. So you're going to take this and you're going to go and get this blood work done and you're going to come back and you better follow up with me or you're going to die, right? So that whole scaring them, coercion, etc., forces them to feel like they don't have a choice. It feels, and it can be very traumatic for them. So eliciting their patient priorities. What are your goals for today's visit? What would help you the most today? Offer choices, even minor ones. Would you prefer to sit or you prefer to stand? Use suggestions rather than orders. It would be helpful if we could. Sometimes, especially if the patient is sitting, for us to be standing, makes it feel, it worsens the power differential. And so sitting next to the patient, leaning forward, paying attention, all those things that we teach them, that is actually trauma informed. And so you can label it as that. Transparency and trust. Explain what you're doing and why. I'm going to listen to the heart and lungs to make sure it's to check on how they're working. Make realistic promises and communicate delays, and announce yourself before entering. And this reduces your startle responses, particularly in trauma survivors. So, and strength-based language. You ask your patient, what keeps you strong, or what helps you get through difficult times. Acknowledge the patient's agency. You've been through a lot, and how have you managed? All of this is patient-centered care, and we're just making sure that we understand that this is also trauma-informed. Cultural sensitivity, so asking for pronouns and using them consistently, and offer gender and ethnic preferences for interpreters when available. Be mindful of cultural specific expectations. All right, so I hope I have provided and met these objectives, providing a curricular overview of the communications curriculum, talking about how to prepare, lead, and assess a small group communication session. And we talked very briefly on a very important subject of what is a trauma-informed approach and how you could be teaching that in your communications curriculum.